Hello and welcome back to my channel. My name is Jo and we're going to have a bit of a serious chat at the moment. So we're going to talk about some mental health issues. So if that's something that you're uncomfortable with, you don't need to watch this video. But I'm really looking at the costs that the pandemic has had on mental health of the people that make the decisions. And today, Victoria's Chief Health Officer, Brett Sutton, opened up on a podcast today about the mental toll that having to make rules that affected the state had on his mental health. Professor Sutton acknowledged that there were pretty significant struggles and that he actually had to go and seek a psychologist. He was torn apart by decisions he knew that would negatively affect people's lives. Queensland's Chief Health Officer, Jeanette Young, she also spoke on this podcast, and she talked about the death threats that she received and the impact that they had. I'm going to link the podcast into the description, also the article. But they discussed the challenges of leading states through coronavirus responses in a podcast from the medical regulator AHPRA, AHPRA. Professor Sutton said, "My wellbeing struggle, and it has been a struggle really through August especially, was that there was not a moment of any day for weeks and weeks on end when I wasn't thinking about the people who were dying, the many, many people who became infected in our second wave. More than 800 people died in Victoria with the majority between July and October of 2020. We got to the point with a very severe lockdown that it was pretty clear that there's no more you can do. You have to let it play out over time," he said. But the ruminations on every little decision around, knowing that more people would die, that this was the kind of unfettered transmission across the state, was a really heavy, heavy burden. He said there were days where he was away from his family, and while he was physically there, he wasn't mentally with his family. He had to work with a psychologist who would reinforce self-care measures. And he said he had a good team of people around him. Well, today, which is, let me just check my watch, the 16th of March, I knew that anyway, marks 12 months since a state of emergency was declared in Victoria, and the Chief Health Officer actually had the powers to make decisions in the state for health measures. And January 29, 2020, Queensland government declared a state of emergency, and Dr. Young was in charge of making the decisions. You see, every one of these decisions made by these chief health officers affected millions of people's lives. The previously invisible health bureaucrats emerged as unlikely household names. Dr. Young received death threats, and a 70-year-old man from the Sunshine Coast faced court. Not only did he send death threats to Dr. Young, but to the Premier, Anastasia Palaszczuk, because he had to miss her funeral during COVID-19. Professor Sutton doesn't have Facebook or television at home, but he recalls journalists going to his house and having his daughter answering the door in her pajamas. He laughs because he became somewhat of a celebrity, because there were homewares and calendars emblazed with his face, which he found very comical. But the flip side was the anger that he had to deal with. The anger that he had to deal with from the people who were very angry at the decisions he had to make. He talks about how he was torn apart over every one of his decisions. There are decisions to be made that will affect thousands upon thousands of people and cause harm, but against an alternative that looks more harmful. But there's no path you can take in which people are unaffected, and so you really have to remind yourself that those accusations that harms would arrive were not invalid. They were always going to arise. You were just going to have to try and find the least worst path possible, Professor Sutton says. His brother also lost his job during the first lockdown, and he was unable to see his mother either. So he talks about how the decisions that he made affected his own family and the heartbreak. Dr. Young also tells the podcast that she had to face some ethical issues when they had to come up with a plan of what they would do if they couldn't treat people, having to turn people away. She hoped they never got to a situation where they would actually have to make those decisions. So Dr. Young also talks about the fact she lost a lot of weight because of the pressures of the job. And then she says, really and truly as a nation, we have done really, really well, and that's due to our people. I think what we've got to take out of this is that these people, particularly our health officers, have had to make some pretty tough decisions, and they are people at the end of the day. They have family. They are humans. So we can criticize and hate them as much as we like. But at the end of the day, they are real people with real feelings, with real emotions. And I commend Professor Sutton for admitting that he had to go seek professional help. If you are struggling with feelings because of the pandemic, please seek out some help. Speak to somebody. Don't suffer in silence. And also, Professor Sutton, saying I had to seek help. I had to find somebody to help me is something that we all need to do. We need to have that team of people around us to get through those times. So on the anniversary of the state of emergency in Victoria, 1 year on, wow, what a journey we've had. To Victorians, congratulations. We got through it. To Professor Sutton, I don't know how you did it. I don't know how you did it. Those were some tough decisions. And I think there's been lots of lessons learnt, and there were mistakes made, surely. And I'm not standing here and saying what's right or wrong. I'm sitting here saying that this podcast really tells us that he is actually a human being with emotions, and his decisions, he was very well aware of the impact his decisions would have. Anyway, I'll catch you all later.